Welcome back to the Doctorates Talk Show. We're here to raise your awareness about healthcare in the community. I am your host, Jennifer Leslie, and I'm with my co-host, Dr. Catherine Tikem. So, Dr. Tikem, what is going on? We're finding out that people are actually committing crimes so that they could go to jail, so that they could get health care. Is that for real?
That is absolutely real.
Well, how comes?
One of the major problems with health is the cost. Cost of insurance is a major problem that causes people who do not have insurance to commit crime to get proper health care in the jails.
So, the major problem in accessing health care is cost. Is that correct?
That is absolutely correct.
So, let me see something here. So, if I don't have any money and I'm really sick and I want to get some care, why can't I just go to the hospital?
You can't go to the hospital because they are required to take care of you at the barest minimum. Yes, you can do that.
Okay, so we're missing out. Tell the audience what's going on, because I'm totally lost. I know that for a fact that people have been committing crimes just so that they could go to jail and then go just to get health care. So from the need to have health care to jail for health care, it's not adding up. Now, you work in the prison system. I know that for a fact. No, the correctional facility. Right. I know that for a fact. Right. So you're basically an expert in the field. What we're talking about here, is it all adding up and does it make sense?
Actually, it starts with a person getting sick, going to the emergency room.
Does it make sense or not?
It doesn't make sense in actuality. However, people who get sick go to the emergency room, they get the basic health, and they're told, go to your primary care doctor. Unfortunately, they do not have a primary care doctor because of costs. And so they commit crime so that they can get the primary care doctor in the jail or in the prison.
Okay, so not everybody, obviously, who gets sick goes to jail for health care. Only the people that can't afford it. But even if you can't afford health care, you can still go to the emergency room. More likely than not, if you're sick, they will not turn you away. At least they're not supposed to. But what happens, as Dr. Tikem is saying, that if you're not in need of emergency room care or no further emergency room care, you're then discharged home. Okay, see your doctor tomorrow, follow up with your doctor. That's where the problem lies. Because, so you'll find these people that keep going to the emergency room. Is that not right?
That is absolutely right. They go
so
to the
tell me, how does that go?
They keep going to the emergency room, they get the basic care, but they are to follow with their primary. However, having
primary what?
Primary doctor. However, not having insurance to pay for the primary doctor, their illness continues to grow, it gets worse, and they end up back in the emergency room.
Yes, but
and there's the cycle.
Okay, but if you don't have insurance, you can pay, it's only what, $75? $125? Is that not correct to go see your doctor?
Medical care has skyrocketed so much so that even a little bit of expense can add up over time.
I got it. So you're discharged from the emergency room. you go to see your doctor, and you get a bill, right?
Right.
So you're saying that it's not just for the visit, but it's for other costs, right? Lab work?
Yes.
Right?
Yes.
Other tests,
Yes.
right?
Yes.
Okay, so it mounts up.
Yes.
So it's not just the $50 or $75 or $125, right?
Right.
Okay, so now, in answering the question I asked you before, so no, it doesn't make sense to commit a crime just to go to jail for health care, but how about if you're really sick? How about if you have cancer and you need to have surgery and you have no insurance?
I have an experience in that people have been known to commit DUIs. They get arrested. They come to the clinic in the jail. There you find a terminal disease that has been diagnosed many years before, but they could not follow up. And these are some of the reasons that they come to jail, so that that treatment can be started.
Okay, so you may have somebody who has been in and out of jail, right? In the hospital, they call them a frequent flyer.
Right.
I don't know what they're called in jail, but they come in and they go out. They come in and they go out, right?
Right.
But they may be suffering from a chronic illness where they need to have surgery. They know that they need to have this surgery, and so here comes the police, pull them over. There's a warrant. They get arrested. They go to jail. Opportune time, because now you need surgery. You knew all along you need surgery, and
Right.
this is the time that you're able to get this treatment.
Right, absolutely. The jail health system is just as good as the health system out there. However, it's free because they're incarcerated. And it is at this point in time that we would need to work up that chronic illness, that diagnosis, and begin the treatment process free to the person.
Okay, so if someone with cancer, for instance, who needs to have surgery, and they commit a crime, deliberately commit a crime so that they go to jail. By the way, isn't that illegal in itself?
Not to the person who knows that they need the health care but cannot access it on the outside as a free person.
Okay, so when you are choosing to have surgery in jail, is it okay to say they're choosing life over death? Because, okay, as a patient, I could say, well, I'm not a criminal, but I have cancer, I need to have my surgery, and I know that if I am in jail, or in the prison system at least, I'm going to have my surgery, and then my grandkids will be able to see me. I'll be able to see my grandkids from prison. However, if I don't get the surgery, which I won't get anyway because I don't have the money, I don't have the insurance, then
You could die.
I'm risking my life. I'm gonna die, and I won't see my kids. I won't have a life. So basically, do they really have a choice?
They really have a choice. Everyone has a choice of living or a choice of dying.
They're choosing to live. Is that not correct?
They're absolutely choosing to live.
So by choosing to live, you have to choose to go to jail. Because this is America, this is the healthcare system, this is how it works here.
Right.
Is that not correct?
That is correct.
I am feeling disgusted. I'm feeling disgusted not only because I'm listening to you, but I sneaked and did a little research.
Okay.
I knew that you were the expert, and I was going to be interviewing you and getting my questions answered, but I wanted to really do a little bit of research, And lo and behold, I found a lot of cases where people have in fact committed crimes just so that they could go to jail, just so that they could get their surgery done or their health care for free. This is the healthcare system that we have here in America. This is the system that we live in. This is America.